Hello everyone, in this video we'll be reviewing the pharmacology of vancomycin. Vancomycin works by inhibiting the bacterial cell wall synthesis by binding to the dealanine portion of the peptidoglycan precursor, preventing its polymerization and disrupting the cell wall. This ultimately leads to the bacterial cell death. Vancomycin covers MRSA and all gram-positive bacteria, and it is most commonly used antibiotic for MRSA. Common adverse reactions to vancomycin include nephrotoxicity, which is diagnosed by more than 2 consecutive increases in serum creatinine concentrations by 0.5 or by more than 50% increase in serum creatinine from the baseline. Ototoxicity, which caused by damage to the auditory branch of the 8th cranial nerve. It can be presented as tinnitus, and at certain times can be irreversible. Also, infusion reactions. Rapid infusions of vancomycin can lead to flushing of the face or chest, also known as vancomycin infusion reaction, and this can lead to hypotension or even cardiac arrest. Now, there are 2 types of dosing when it comes to vancomycin. First, we'll review the traditional dosing. This is dosing by the trough level, so trough level monitoring, and 10 to 15 is usually for skin or soft tissue infections or urinary tract infections, while higher trough level goals from 15 to 20 are for more severe infections, including bacteremia, sepsis, endocarditis, central nervous system, and pneumonia. The trough level is usually drawn 30 minutes before the 4th dose is given. So for example, if the first dose is given on Monday and the 4th dose is dosed on Thursday, you're going to want to put in those lab orders 30 minutes before that 4th dose on Thursday. And you want to monitor trough once weekly for stable patients. You can consider monitoring trough levels at least twice weekly for patients who are over 55 years old, who have underlying renal dysfunction, and who are taking concomitant nephrotoxic medications. The second method of dosing vancomycin is AUC-MIC dosing, and you want this ratio to be at least from 400 to 600 to have benefits. Benefits of dosing through this method include more accurate patient-specific dosing, decreased chance of nephrotoxicity, and the kinetics can be ran after the 1st dose and doesn't require waiting until steady state, less levels to be drawn overall, and levels over 600 are associated with an increase in renal toxicity, and vancomycin is considered a narrow therapeutic drug. Therefore, you want to monitor labs. So anyone taking vancomycin or patients on vancomycin, important labs required to monitor and trend include initial baseline labs, BUN, serum creatinine, and ongoing labs include white blood cells and neutrophils, BUN and serum creatinine, any abnormal lab values, CRP, and of course, vanco drug levels. And that's all we have for Vancopharmacology. Please make sure to like and subscribe, and I'll see you in the next video.